Accidental bowel leakage is a distressing condition. Distressing. I mean, can you imagine if I'm walking out and just a stool pebble is falling right behind me? How distressing it would be to me. But that is what happens. I don't realize that the stool is coming out and it just comes out. And that is because the sphincter is so weak and I don't even realize it's coming out. So there are different types of fecal incontinence. Some are associated with hurry. That means I can try to make it to the bathroom, but before I can make it, it's almost coming out, even though it's well formed. Or sometimes it's called passive incontinence. I don't even realize it's coming out and it's sitting in my underwear. And this is not mush, this is not diarrhea, this is not food poisoning. This is actually relatively well-formed stool that comes out. So it is a huge problem, very distressing. So when patients come to see us, we understand this problem. We ask them specific questions pertaining to bowel leakage. We ask them how much it affects their quality of life, and then do a very detailed urogynecologic assessment, including assessment of the rectal sphincter. So I do a rectal examination, see how well she can contract on my finger. And when she's straining down, is she relaxing the sphincter? Does she have stool entrapment in the rectum? Is she constipated along with? So we look at all those factors. Then we have the patient keep a stool diary to see what is the type of stool that she's passing. And one end is mush diarrhea, the other end is pebble. And where is she? We want somewhere in 4, which is a well-formed stools. Then we do some specific tests for the rectum. So a lot can be done in the office, but more importantly, it is to understand how often is it happening, how bothersome it is to the patient, when does she notice it, and also the importance of not just the history, but what other medical conditions does she have? Does she have bad diabetes? Has she had any surgeries around that rectum? Or does she have any other bowel conditions? And then doing a proper examination. And just a digital examination is critical before we go on to testing.